Hi, my name is Dave Measle. I'm the Executive Director of the Pennsylvania Peer Support Coalition, and we are really excited to be presenting these videos today. We just continue to grow and continue to do whatever we see is necessary to support the profession of peer services. Which brings us to this video, or these videos. One of the things that we recognize through conversations with other peer specialists and through our own experiences, because most of us who work here and are on the board of directors are peers ourselves. One of the things that we recognized was the need to have some more information out there about what a typical day of a peer specialist looks like. What are the real world things that a peer specialist encounters. The 2-week training is amazing, and as I said, most of us are peers here at the Coalition. We've all been through one of the 2-week trainings, and we all walked out of that training feeling super inspired and super ready to go out and do this work and uplifted, which is awesome. But we wanted to provide some additional information about some of, again, the real world experience of a peer specialist. What does the day-to-day life of a peer specialist look like? What are some of the challenges that peer specialists face while providing this service? Our original vision was to create some in-person classes that people could come to and get information on, and we would create, slideshows and, PowerPoints and things like that. When we actually started to pursue that or discuss it more, it became clear that that wasn't going to be the best, most efficient way to achieve what we wanted to with this project. So then we kind of evolved and moved into creating this series of videos. And so then what we did is we went out and we started talking to other peer professionals, people who were on the ground doing the work face-to-face with peers on a daily basis. So that we could get their perspective on it. We had our own perspectives from our own experiences, but we wanted to gather as much as we could from other peer professionals across the state as well. So we started having these conversations. We sent out surveys, we had focus groups, all around this idea of what would you have liked to have known prior to taking the 2-week course. Knowing what you know now, as a certified peer professional, what's the information that would have been helpful to you before you decided to move in this field, to move in this direction? And what we got from these discussions were kind of 6 basic areas that people really felt like they would have liked more information, in making a decision to move into peer work. None of them said that they hoped or wished that they had not moved into this field. But not all were still in the field either. But there were 6 areas that people really wanted more information or would have liked more information. And the areas included things like, what does the day-to-day life of a certified peer specialist look like? What does a day in the life of look like? What does documentation look like? I didn't know anything about documentation before I became a certified peer specialist. I would have liked to have known more. What does the actual certification process look like? How do I become certified? Information on ethics and boundaries. I would have liked to have had more information on that. What does the process through the Office of Vocational Rehabilitation look like? So we took these things and we said, okay, these are the things that we're being told that people wanted more information on. And we developed a set of questions around those topics. And then we went out and we set about finding subject matter experts in Pennsylvania. People who had done the job, who had, been a face-to-face peer for years and had a lot of experience doing this work so that they could share their insights with you. And so we started meeting with them, and what we did is we just set up a camera and sat down and we asked all of them the exact same set of questions, gathering information on these topics that we had been told were things that, people would have liked to have known. And so the following videos is really the result of these interviews, of talking to, as I said, very experienced, very well-spoken certified peer specialists who had a lot of knowledge and a lot of insight to share. So we hope that these videos are going to be viewed by people who are interested in becoming peer professionals, who maybe want a little more information, for people who maybe aren't interested in becoming peer professionals but want to know more about what are peer professionals, like what do peer professionals do. So we're putting these videos out there as an educational piece to teach people or to inform people on peer services and what they are and what a day-to-day life looks like for an individual who does the work and is on the front lines every day. We have really enjoyed making these videos and meeting with these subject matter experts. They have all been amazing partners to work with on this project. We believe what we have to present to you is some really good information, and we certainly hope that you're able to take away some great, helpful, insightful information that will help you make a decision on whether or not you want to become a peer professional. Or if you're not becoming a peer professional, we hope that there's information in these videos that you can take away and walk away and say, now I really get it. I understand what a peer professional is. I understand the work that they do. I understand how important the work that they do is for the community. On behalf of everyone at the Pennsylvania Peer Support Coalition, I want to say thank you for taking the time to watch the videos. Know that we are here, that the coalition exists to support peer professionals and those who support the profession as well. So, if you need us for anything, we are here. Our contact information is in the videos. Feel free to reach out to us, but most of all, thank you for taking the time to watch the videos. And again, we hope that you really get some good information out of them and find them useful. Thank you. So there are a lot of different provider agencies across the state of Pennsylvania, and they're all going to have their different organizational policies. They're all going to have their own office politics, so to speak, and they're all going to, probably feel a little bit different from one to the next. So I don't really want to get into, you're gonna encounter this policy if you start working as a certified peer specialist, because they will vary from organization to organization and from provider agency to provider agency. What I do want to say, or what I do want to emphasize on this question, is to recognize that peer support is a profession. And that's something that we've really kind of fought for over a number of years. When peer support first started to be offered as a Medicaid billable service, there was a stigma associated with it, I guess I would say, in that other providers, other mental health providers, agency leads, didn't view peer supports as professionals. And that was expressed in many different ways, from office policies to how peers were treated, to pay rates, to all kinds of things like that. And so we've been working very hard to change that perception among other mental health professionals, to view peer supports as professionals. So I would say, in relation to this question of organizational policies, is to recognize that you are a peer professional with the other people in your agency that you're working for. Now, there are some agencies out there that only offer peer support, and that's awesome. I love those kind of agencies because then everyone there is a peer. There are some agencies that offer only peer support, but the leadership isn't necessarily peer. So you're still a professional and you still need to present yourself that way. The majority of peer jobs are in agencies that offer a wide range of services, that offer, case management, that offer, therapy services, and offer all kinds of stuff. That doesn't mean that we as peer professionals are anything less than those other professionals. We are professionals as well. We should be treated as such, but we also need to present ourselves as such.
When it comes to policy, I have a standard for myself. And generally the standard for myself exceeds what the organization is going to expect.
Sure.
So basic policies, take care of yourself, don't show up to work drunk, high, all of that good stuff. Some of the simple stuff, we're not going to go out there and bash people with their stories. A lot of organizations will have their own particular brand of recovery, their own programs that they want you to push people towards. The biggest thing with organizations is knowing that peer support is based on that many pathways to recovery.
Sure.
And you always want to identify what other opportunities in those many pathways are within the organization. Because if we can keep them in-house fully, then we keep them in-house. But if it needs to be that we refer them out someplace else for specific stuff, then we have to know how to make those referrals.
Transportation is probably one of the big ones. We know that we can't bill while we're transporting folks, but the PCB, OMSAS, everybody, they don't say that we can't transport. They simply say that you can't bill for it. So I've heard of companies that allow you to transport. I've heard of companies that do not allow you to transport. I've heard of companies that say in very limited circumstances to transport. So that's probably one of the biggest. Also, things like paperwork submission times and things like that. That'll vary, but your organization's definitely going to have, this is when things are due. Supervision, that's a requirement, so you're definitely going to experience that, whatever that looks like for your agency, but you'll definitely have, a set time for supervision at any given time of the week. Also things like call-off procedures, vacation policies, sick time policies, what happens if your mom or aunt or gets sick, like those type of things are pretty common as well.
Some of the organizational policies, definitely concerning confidentiality and privacy when it comes to client, participant, and individual information. You have to be mindful of what information you share, whether what you can say to certain people. Because a big piece of my background before coming into peer work was working in different government organizations, it was always drilled in us that we had to be mindful of personable identified information. That even though someone's name, just simply John Smith, that we could not say a person's full name when we were out in public. That you most likely had to say either the first name and the last initial, or you had to give both initials. So if I'm talking to a coworker or someone within John's treatment team, I had to either say John S. or JS. Understanding confidentiality, what information can be shared, understanding what you can share with the individual as far as resources are concerned. If you're able to give money or gift cards for transportation, for food, if you can accept those gifts, because oftentimes individuals, they want to thank you with maybe buying you lunch or buying you a cup of coffee, but you have to be mindful that that might technically be illegal depending on your organization. What's that dollar amount for a gift? And if that individual wants to give you a gift, can you accept it personally, or can it be donated to your program? So just as with policies and procedures, when it comes to that orientation and that employee onboarding, it's very important to understand what is legal, what is okay, and what isn't.
It's very simple. If we want to keep our jobs, we have to do what we're told. It's just that easy. You know, most jobs I've had, I got a member or an employee handbook, and you know, you got to follow the employer's rules.
But I know in my training, when I was trained, the number one thing that I can remember that was kind of lacking was the policies, the procedures at different places, the resources, and things like that. So don't be afraid to ask questions. You have to ask questions. How else are you going to know? Handbooks, you know, policy, procedures. I mean, you don't need to know all of those for, you know, every place you go, but it's good to know what's tolerable and what's not.
And some of those folks, what worked for them wasn't working for me in terms of professionalism. Mm-hmm. You know, I saw folks that would cuss out their peers. You know, you're supposed to be working with somebody, but you're cussing them out, calling them all out to names.
Yeah.
Or, you know, something simple, hey, loan me $20 till payday. And, you know, just those things that I saw, I knew that I didn't want to do.
Sure.
Because I can see how that would backfire completely. You know, peer, let's say, you know, I borrowed $20 from you, and then we got to work together next week. You're going to walk in and, bro, where's my $20?
Right.
That's going to defeat the purpose of why we're there to, you know, help each other in recovery or whatever. So watching those things kind of gave me that idea that first off, I have to hold my recovery higher than anybody else's. Just because that person can go after work and drink 2 beers, I've never drank 2 ever. You know, if I drink 2, I'm going to drink 20.
Sure.
So no, I can't go after work with you and have a couple beers. No, I'm not going to hang out at the bar. I can and have, you know, with other people that know my recovery story, but generally I don't do it.
Right.
So when it comes to that professionalism, I had a guy that he was a peer and kind of helped me into it when he was working at the MHA, and he also told me, he said, look, you're going to see a lot of stuff around here. Know that you can't do it. You can't do it because you're a different caliber of person. And that stuck with me all these years. So no matter where I went, I carried that level of, this is what the way we're going to do things. Everything's above board. I'm not going to give anybody an opportunity to point at me with something that'll bring me down, because I got enough in my own story.
Sure.
That, you know, if we open Pandora's box, can bring me down. Plus, I also look at it from, you know, kind of that paranoid point of view. Mm-hmm. That, okay, we're talking about peers. And when you throw out terms like mental health, addiction, et cetera, folks are already watching us. Don't give them anything
Sure.
that's going to affect the next person getting certified.
Listen more than you speak. I think for me that was my hardest hurdle, was I need to be heard. My perspective is right, yours is wrong. And saying you don't know. That's not always something I'm the best at. I've gotten better at it over the years. You know, I think in the beginning of my career in field of peer support, if I didn't know, I was making something up. Just so it sounded good and I wasn't in a position where I didn't know something. But really, there's power in being able to say, hey, I don't know, show me. Number one, it shows the people that you're working with that you are human and you're trying to get better. And 2, it kind of puts us in that perpetual learner frame of mind.
In terms of professionalism, there's a lot of guidelines. There's going to be agency guidelines, there's OMSAS guidelines, there's us holding us accountable guidelines. Pick a standard. If your standard is that, I'm going to be the best I can be, I'm going to ask for help, I'm going to do all of the things that we talk about as peers, those words we throw around, non-judgmental, be there and stay there. And then, remember that we are not alone. We're surrounded by peers that can give us advice, and if you're ever unsure of what it means to be professional, ask. So take something simple. If you walk into a building and it's your first day on the job and everybody in there is wearing a shirt and tie, it might behoove you to go get some shirts and some ties. If you walk in and everybody's got on jeans and t-shirts, then you can wear jeans and t-shirts. But the easiest way to find out is to ask, hey, what's the dress code? And then there's a way to tell our story that shares the mess, and there's a way to tell our story that shares the message. Lean towards the message, because the mess is going to attract some things that some folks are not ready for in their own journeys.
If there's something in your gut that is asking, should I be doing this? It's probably right. I think back to being a teenager. I knew when something wasn't right. Drinking at a party in the middle of a cornfield at the age of 15 or 16. I knew it didn't sit right with me. I think that inner voice is an important thing to listen to as a certified peer specialist, because especially now with the PCB and the signing of the codes of ethics and them overseeing our credential, one little choice not to hold myself to the highest professional standard possible can severely alter my ability to do this job long term. And I'm almost 10 years in. I've invested a lot into this career. So know, read, and understand those codes of ethics, and then structure what you do as a certified peer specialist around that, being firmly rooted in professionalism.
This is a growth process, and I think everyone's going to get to being a certified peer specialist and get to a point that they're comfortable with the job and that they're not feeling so overwhelmed with it anymore in their own time and in their own way. Doesn't mean you have to do it alone. There are other certified peer specialists. There's your coworkers, there's your supervisor, there's the support system at the provider agencies that you work for. There's there's the Pennsylvania Peer Support Coalition as well. We're here to support the peer professionals of Pennsylvania. So I don't necessarily think that the question needs to be, well, how do you get there faster? The question is, how do you get there in your own way? And just like your own pathway to recovery, what is your pathway to becoming a certified peer specialist, if that's what you decide you want to do with your life?
I would say to be very mindful of your tone and your body language. And everything is not personal, that you are a piece of a bigger picture. So oftentimes, if you are questioned about something, it's not to say that it is wrong or right, but it is for you to provide more information so other people can understand your job and your position. So don't take it personal, and be mindful of how you engage with others.
One thing we don't teach in the training is something you got to bring with you, or something you got to have, and that's empathy, right? So if you're an empathetic person and you care about people, that is a great start, right? You can learn and grow and get taught the rest. So be empathetic, be able to listen to different points of views is helpful. Be able to challenge your own thinking. I think that's helpful.
Look professional, dress reasonable, eye contact, smile, grooming, your basics. and speak your truth.